Hi, I'm Dr. Yen, and today I want to show you the effects of soft tissue adhesion on your body. So a muscle is much like a spring. Here I have a slinky, which is acting as my spring. As I lengthen this spring, all the different individual rings pretty much all lengthen equally. That would be the sign of a good, healthy muscle. Say at the bottom of a squat, many of your muscles will be lengthened and primed and ready to contract. So you get a lot of force production by having a little bit of lengthened tissue at the bottom of the squat, and then boom, everything contracts and you get out of the bottom of the squat. The problem is with trauma and overuse, scar tissue starts to form around these areas. So if scar tissue forms in a muscle, for example, it'll start to bind some of these rings or some of our spring here. As that binding occurs, we start to lose tissue extensibility and we start to lose force production. So we start to get a little weaker in those areas. So as you can see, now those rings are no longer in the picture, they're no longer in play, and if we were squatting, we wouldn't be able to use them. Instead, we can only continue to use the healthy tissue. As the healthy tissue gets overworked, since these guys aren't in the picture anymore, it leads to further compensation and more adhesion or scar tissue forms as a result. So you can see how this can lead to a downward spiral in a sense, because more and more of the tissue starts to get involved. And if we simply just continue to stretch and strengthen through here, we continue to feed this compensation. So the best fit treatment for this is actually a biomechanical assessment to identify exactly what tissues aren't lengthening, exactly what parts of the tissue are having adhesion, and then manual treatment that hones in and really gets into the areas of adhesion, leaving the healthy tissue alone and treating only the dysfunction. As the healthy tissue is left alone and the dysfunction is treated, recovery from injury or recovering from movement inefficiencies becomes quick and predictable. So once again, we now have all of our springs working, all of our rings are lengthening as they should, and our force production is back, and once again we can squat without problem.